Hi everybody, I am Mrs. Shobiya, M.Sc Nursing, Associate Professor, Department of Community Health Nursing, E.S College of Nursing, Villupuram. Now I am going to present a topic regarding health maintenance. In introduction, the health maintenance, it includes screening procedures, risk assessment, early intervention and prevention. So under prevention we have primary, secondary and anticipatory. So the prevention includes primary prevention, secondary prevention and tertiary prevention. Primary prevention includes early diagnosis, specific protection and rehabilitation. Guidelines for health maintenance in some age groups are quite well established, especially for children. Especially for children, the health maintenance is somewhat very important when comparing to other age groups. The next one is the definition of health maintenance. It refers to activities that preserves an individual's present state of health and that prevent disease or injury occurrence. And examples of these activities include screening or surveillance, providing immunizations to prevent illnesses and health education. So the health maintenance, it is the activity that preserve an individual's present state of health and prevention of disease and injury. And also it includes all the immunization procedure, screening procedure and survey, everything. Next one is health maintenance strategies. So the health maintenance strategies includes screening. So under screening, the important disease condition will be checked out. For example, non-communicable diseases. By screening, all non-communicable diseases can be screened, and as per the screening procedure, the treatment can be done. The second one is health education and counseling. Health education is playing a vital role in community health nursing. Also counseling. Counseling is very essential also. The counseling can be given about all the health aspects. And the next one is immunization. So immunization against all preventable diseases, 6 killer diseases and all type of diseases, the immunization can be done. So these are all the 3 important strategies of health maintenance: screening, immunization, health education and counseling. And the next one is maintenance of health. How to maintain a health? So if any person wants to maintain a health, first the person should be aware about the wellness, that is healthy lifestyle. Wellness is determined partly by lifestyle choices. Also the patient or the person should be very aware about all of the content like healthy eating, physical activity, mental stimulation, not smoking, active social engagement, moderate alcohol use, safe environments, social supports and regular health care. So these are all very important in maintaining health status of a particular person. The next, other factors related to wellness. The factors which improves the wellness of the person includes fitness. The fitness can prevent heart diseases, hypertension and lower back pain. Also it prevents some other diseases also. So the fitness is very essential to improve the health status of a person. And the second one is safety, prevention of injuries, accidents, emergency preparedness, CPR, cardiopulmonary resuscitation, everything are very essential to improve the health status of a person. And the next one is preventive care, including immunization and health care screening test. So through immunization and screening test, the particular person can prevent the future diseases. And next important one is nutrition. It prevents diseases like osteoporosis and cancer, and proper nutrients are very essential. So to maintain a healthy status of a person, nutrition is playing a major role. Next, quit smoking and tobacco. So quit tobacco and smoking is very essential. Also stress management and spiritual health. So the stress management improve the mental status of the person, and the spiritual health is also improving the holistic health of the person. And healthy lifestyle, health maintenance practices. Become aware of the obvious and not as immediately obvious situations that trigger stress. So minimizing stress is very essential, and the stress triggering factors also to be minimized. Minimize or avoid exposure to those situations. The situation which causes stress should be minimized to maintain a health of the person. Establish good dietary habits. Dietary habits are very essential. Good and healthy diet is very important. Eat well balanced, nutritious meals and moderate intake of salts, fats, white sugar, caffeine and alcohol. So these are all some of the dietary habits to maintain our health in a proper way. Avoid smoking. Smokers are at a much greater risk of dying from heart disease, respiratory disease and cancer. So the person who wants to become healthy should quit smoking, and there are no safe cigarettes, and chewing tobacco and snuff should also be avoided. And establish a pattern of regular cardiovascular exercises. These cardiovascular exercises will improve the positive mental attitude. So there are some cardiovascular workouts: jumping jacks, plank jumps and scissor hops, mountain climbs, touch floor and butt kickers and high knee march. So these are all some of the cardiovascular exercises which will prevent mental disturbances. And conflicts. Expect conflicts to occur, but learn to deal with them in a head-on manner. An unnecessary burden is created when conflicts are allowed to go unaddressed for too long. So the conflicts creates more mental problem. So the conflicts to be unaddressed for too long. And learn how to relax. Relaxation is very essential, very important factor to maintain the health status of a person. And relaxation brings to the body enormous restorative energy, and getting enough sleep is also important. Minimally 6 to 8 hours sleep hours is very essential for a person. And develop and maintain social support. So social support is very important factor which will improve the health status. Feeling connected to family, friends, classmates, work colleagues and or to community, social, political or religious organizations plays a vital role in the maintenance of one's mental well-being. So the person's mental well-being is maintained by all these social groups. And whenever the patient or the person want to meet the doctor, so the person should meet the doctor regularly for preventive care. To prevent future diseases, the person should see the doctor regularly. So preventive services, the following like test, screening, measurements, BMI, body mass index. So through that the person can know about the health status. Advice about diet, exercise, tobacco, alcohol and drug use, stress and accidents prevention, and immunizations, special tests at certain time in your life. So above 35 years of female, some of these special tests are very important to maintain their health. So, whenever the patient or the person have any problem, immediately the person should meet the doctor. So, see the doctor regularly for preventive care. And to take care of our health, we need to feel comfortable talking with our doctors and nurses. So, if we have any doubt, we should be very free to talk with our doctors and nurses. Ask questions. If don't understand what they are saying, ask them to explain. So, if we don't understand what the doctors or nurses are saying, we have the right to ask them to explain. And tell providers our health history as well as our health now. We should not say any wrong information to the doctors and nurses so that they can identify our real disease condition. Mention family history of diseases and conditions. Provide a complete list of medications we are taking, etc. Regarding our health history, everything to be taught to the doctors and nurses. And follow up. Call the provider if you have questions or need more information after or leave. After the discharge or after or leave, the follow up is very important to maintain our health, to have more information about our health status. Health maintenance practices, it includes set small goals instead of large one that won't be able to meet. So, we can set small goals instead of making large one. Reduce the risk for heart diseases. So, the heart diseases can be reduced by following some cardiac exercises. And watch the weight. Regularly, we should be worried about our weight. Eat right, eat healthy diet and stay active. Exercise, 15 minutes to 30 minutes exercise we should have daily. Prevent skin cancer and prevent injuries. Safety measures, safety precautions can be followed to prevent injuries. Take medicines correctly and make smart choices about sexual and reproductive health. Reproductive health is very essential. Simultaneously, we should be aware about our sexual and reproductive health and overcome depression. And the depression can be reduced by stopping the stress triggering factors. And alternative health practices. So, the health or medical practices are called alternative if they are based on untested, untraditional or unscientific principles, methods, treatments or knowledge. If the alternative health practices is offered along with the conventional medicine, it is referred to as complementary medicine. Along with this normal medical care, along with normal health services, we can get complementary medicine also. So, the complementary medicines includes Ayurveda, meditation, acupuncture, yoga and hypnotherapy and Reiki. So, all these are some of the complementary medicine. So, these are all can be used for improving or getting better health. And holistic health care. Holistic in the sense in all aspect, emotional aspect, spiritual aspect, mental aspect, physical aspect, environmental aspect and social aspect. If any person is healthy in all these aspects, that person is a holistic healthy person. Holistic health care in the sense that care that promotes physical, emotional, social, intellectual and spiritual well-being by treating the whole body, mind and spirit. Each person is recognized as a unique person with different needs. So, as per the need of the person, the need to be identified, as per that treatment to be done. Uses many methods of diagnosis and treatment in addition to traditional Western medical practice. This is about health maintenance practices. Thank you.